Hi everyone. For today's Ask a PT episode, we wanted to talk about the difference between a personal trainer and a physical therapist. A lot of times there can be some confusion around the two and what we do in general versus what a personal trainer does. I thought it'd be helpful to have Andrew with us because he also does personal training. He has a CSCS, which I'm going to ask him about in a second. Andrew, can you just talk about what made you want to get the CSCS and what it is, and then how is that helping you in your practice?
Yeah, so me personally, I've always had an interest in personal training. When I started practicing as a PT, I decided that a CSCS would be a strong thing to kind of have just to help with my exercise progressions with patients as I work with them. The CSCS is more focused towards kind of programming. And when we talk about like PTs or personal trainers, the exercise progression is going to be different when we think about where a patient is and how they're doing. So I thought it would be good to have the CSCS because it allows me to take a step a little further in terms of what I can prescribe or what I can have patients do.
A lot of physical therapists nowadays are getting extra credentials like Andrew has. You're going to see a lot of PTs kind of having both or dual roles. The biggest difference between a physical therapist and a personal trainer would be, I think, the focus of what we do. So a physical therapist, we go to school, a physical therapy school that's part of a medical school. So our understanding of pathology and diseases is going to be pretty significant versus a personal trainer. In our world, in physical therapy, we see patients with movement disorders because of Parkinson's or because they have a high fall risk or some kind of disease. Versus personal trainers are maybe focusing more with wellness, fitness, someone who may want to lose weight, they're getting ready for an event, like they want to run a triathlon, or they just want to get fit in general. So that was kind of like the main differences, but there's a lot of in between as well, and that's why I think physical therapists have kind of dabbled or kind of crossed over. The eye-opening thing for me was a couple years ago, I started to do some CrossFit. So I joined a CrossFit gym, and I was just really impressed with the CrossFit coaches and their ability to teach movement. It was kind of eye-opening for me. The way they taught squats and hang cleans or different movements that we use in CrossFit, snatch for instance, they really break it down really well. I was really impressed with that, and so I think physical therapists can learn a lot from that world, and I think personal trainers can learn from us as well, because they're going to be people who come in and see a personal trainer with a rotator cuff issue or impingement or a history of back issues. But I'm really impressed with physical therapists nowadays. If you go to Instagram, the creativity of exercises that are out there is just awesome. My main thing is, okay, we need to prescribe that well to the right person. So a lot of these Instagram exercises that you see may not be right for you. Exercise is not a one fits all. We need to tailor it for you. And so that's what we do a lot of times here. We know your pathology, we know the condition, and how to match the right exercise with that is pretty important. And that's what we provide here. Andrew, anything else in terms of personal training that you're seeing and how physical therapy, there's a marriage going on there?
Kind of to follow with what David said, it's really the scope of practice that's the difference. PTs, we get a lot of schooling to recognize different diagnoses, basically determine a problem and then help you, the patient, kind of fix what's going on. Whereas on the personal training side, it might be more of, like David said, you want to perform a little bit better at whatever sport you're doing or lose a little bit of weight. So it's a natural progression, but definitely a difference in terms of what we're kind of doing.
Yeah. All right, so I hope that was helpful just in terms of delineating the two worlds a little bit. Thank you for your time. We'll see you next time.